Tonight, coming in from Washington, the Senate Republican health care bill would result in 22 million more uninsured Americans over the next decade. That's according to the report just released about an hour ago by the Congressional Budget Office. It compares that GOP bill to current law. The Senate is already facing a tough battle to get this bill passed. They need 50 of 52 GOP senators to vote in favor of the bill. As of right now, at least 5 Republican senators say they will not vote for it as it currently is. Now, I'm here with our political analyst, John Keller. And, John, there are a lot of claims going viral on social media about the size and the scope of health care coverage under this bill. Here's a sample of a common claim circulating on social media of the number of people poised to lose their coverage. It's a call for public pressure on Republican Arizona Senator Jeff Flake, who has yet to take a position on the Senate bill. He's considered a moderate. This claim is that more than 465,000 Arizonans would be left without health insurance under this plan. So, John, give it to us straight. Is that claim true?
Well, it's based on studies of the House Health Plan that passed last month, including some CBO numbers. But the full picture is a lot more complicated. Let's show you what we mean. That estimate includes an unknown number of people who would choose not to buy insurance once the federal mandate is repealed. And if states seek waivers from certain parts of the law that can drive up premiums, lower costs might then keep more people insured than that estimate suggests. So the bottom line is that 465,000 number is surely frightening to Arizonans, just as is the 264,000 people projected to lose coverage here in Massachusetts is frightening here. But these numbers are a guess, not a given, Liam.
We'll see how it plays politically at this point. Here's another one, a tweet by a musician from L.A. This claims that the lifetime coverage caps in the Senate bill could cost a patient their coverage in the middle of chemo. The tweet has been shared thousands of times. Could that actually happen if you have a cap on coverage?
Well, you know, this is the problem with Twitter. You don't know what you're getting half the time. It's a troubling image, certainly, that appears to describe a relatively rare practice called rescission, the retroactive canceling of an insurance policy. Obamacare made rescission illegal, except in cases where patients lied on their insurance application or committed some other type of fraud. But you could also lose coverage for failure to pay your premiums. So the bottom line here is reinstating a cap on how much your insurer will pay. That's a justifiably controversial feature of the GOP plan. But there's never been a law requiring non-emergency treatment for those who can't pay. That's just the way it is. Now, there's all sorts of crazy claims on the other side.
Sure.
And we'll be talking about those more as the days go on. Kellyanne Conway this weekend claiming there are no Medicaid cuts in the Senate bill. How about $772 billion in cuts?
That's what the CBO score just estimated.
Right.
We'll see how that plays out politically here over the next few days. Senate wanted to vote on Thursday. We'll see if that ends up happening. Paula, over to you.